Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Hi, everyone. I wanted to discuss some of the things as clinicians we do that could return lab values inappropriately and falsely elevated. For example, if we leave a tourniquet on too long, we could literally cause hemoconcentration and elevate our values of potassium when they're really quite normal. It could also elevate proteins and calcium as well. The other is leaving or making the tourniquet too tight. By doing this, it causes hemolysis of the red blood cells. And again, it too will increase potassium levels and also the potential for LDH, lactate dehydrogenase, and AST levels will be elevated also. If you incorrectly draw using the incorrect order can lead to contamination. Example, if you do a lavender top tube first, it has EDTA, which is a chelator. So if you use it then in a serum separator tube and there's any EDTA does chelate calcium and you'll get an inappropriate low number. Using a very small needle also can cause hemolysis as well, raising the LDH and your potassium analytes as well. If you shake the tube real vigorously, instead of just inverting it to mix things, that vigorous shaking can cause hemolysis too. It increases potassium, AST, and again, can increase the LDH too. If you delay processing a sample, which can happen if your nurses or your phlebotomist busy, if you take too long, the cells start to metabolize and the concentration of glucose and other analytes begin to change too. And leaving things out too long will also increase the potassium. If you collect from a site used from an IV infusion, it will dilute the blood sample. It'll affect the electrolytes, the glucose levels too. And we have found in times when you're giving intravenous vitamin C, that's not a day to draw after that a BUN and creatinine. It will be abnormal, so draw it first. Blood samples collected after abrupt changes from lying to sitting causes fluid distribution, and certain analytes will also have changes in the blood as well. And patients that are clenching their fists real hard during this, I know sometimes we ask them to pump their fist, but clenching it too hard can elevate potassium levels due to the muscle activity. So once the phlebotomist is in or the nurse, ask the patient to relax their fist. Now, if you store samples at inappropriate temperatures, it can degrade the components and cause shift in electrolyte balances, such as potassium as well. So make sure they're stored in the proper temperature conditions. And incorrect settings on a centrifuge, as minor as it may seem, can result in complete separation of serum or plasma. And it will lead to potential contamination of the sample with the cellular components, again, changing the outcome that you might be expecting. And things are also light sensitive. Some analytes, like bilirubin, are sensitive to light and they can degrade if the samples are not protected from light exposure after they're being drawn. And using the wrong collection tube, like a heparin tube, instead of EDTA is an easy possibility to pull the wrong tubes, and it may lead to incorrect results, of course, as well, because of the additives in the sample. So I always ask my nurses to lay out exactly what they need first, so that mistake hopefully is minimized. And lastly, failure to adequately mix anticoagulated blood will lead to clot formation, and that affects the cell counts and other relevant tests. So invert these test tubes, don't shake it vigorously, and follow some of these simple things that we just talked about. I think you're going to find much more accurate results. If you need to write me, you can do so by writing to Dr. Mitch at mitchgen.com. That's DrMitch at MITCHGHEN.com. Thank you for watching.